Hello, good evening, everybody. Thanks to each and everyone for joining in today for this awareness webinar on preventive vaccination in cervical cancer. This is an initiative of Doctors for Society supported by Rewari Obs Gyn Society, Lalita Memorial Hospital Rewari, Golden Lioness Club of Rewari, and RPS Group of Institutions. We thank the esteemed faculty and all the attendees for joining in today. Dear attendees, please post your queries in the chat box or Q&A box during the session. The queries will be answered at the end of the session. We now request Dr. Seema Mittal ma'am to start the program. Dr. Seema Mittal is the Director, Lalita Memorial Hospital Private Limited, Rewari, and she has been the past President, Rewari Obs Gyn Society, and currently Secretary, Doctors for Society. Dr. Seema Mittal ma'am.
Today's topic is very, very important because recently I saw a patient. She was 65 years old and she came with just spotting for a day. And when putting in a speculum, I just saw that there was grade 3 cervical cancer. We did a biopsy, turned out to be cervical cancer. When I told the relatives, they just refused to believe me that one day history with everything fine, maybe you are wrong somewhere. And same day, the two girls came for vaccination. Till date, I was not really sure about the effects of vaccine, but that day I realized that if something can be done well in advance, maybe we really laid a helping hand to the society. So this is how we start. Can we have the first slide? So we have experts on the subject to talk about this vaccine, and it was my deep desire to know the facts from them. We have with us Dr. Sweela ma'am. She is National President-elect IAPSM, Professor of Excellence, Director Professor HAG. She's ex-head and sub-dean Maulana Azad Medical College and head community medicine. Her children orator IAPSM, KNDA orator IPHA, and she's fellow HIV medicine, advisor ICMR member task force, honorary secretary general and director sound hearing. And she's been associated to Maulana Azad Medical College and other hospitals and has been guide to WHO on various issues, and who better person than her to give her expert comments on the subject. Then we have with us Dr. Sadhna, and this is the long list of ma'am, and she is very active on Foxy platform, and she's heading the co-chairing the support NCD committee, Foxy representative to support for year 21. She's ICOG Governing Council member, and she has got awards for Best ICOG Governing Council member. And the ma'am has done n number of conferences, and she's been a very active social worker, and she's received great academic honors like Chancellor Medal for Best MBBS student and recipient of 9 gold medals in MBBS and thrice Korean Award for Best Scientific paper. And it's really good to associate with ma'am on this subject, and I'm sure that she will unfold many queries and dilemmas regarding this subject. And we have with us Dr. Anita Khan. She is MBBS MD FICOG, and she's chairman and head of Department OBGY, Asian Institute of Medical Sciences. She's president IMS Faridabad. She's patron Faridabad Obs Gyn Society, and it's our pleasure to be with ma'am. And Dr. Pavitra Rao, she is ma'am is the bridge between the beneficiary and the service providers, and through her we will be reaching the actual population which we are targeting. Thank you, Dr. Pavitra, for joining us. And now we start with our first slide, and we have Dr. Kanchan Saini, Senior Consultant Civil Hospital Rewari, who will be joining us shortly. And we have Mrs. Nirmala Yadav, because this was a request from Lioness Club as well. This topic should be discussed. And we have Secretary Dr. Nirmala Yadav. She's the Secretary of Golden Lioness Club Rewari. She's Assistant Professor, Department of Pharmaceutical Sciences, Indira Gandhi University, Mittal. So with all the dignitaries on this platform provided by Deepika ji, we proceed to our first slide, and I hope this webinar is going to help not one but everyone. So we will be talking about HPV and preventive vaccine. HPV is human papilloma virus. So now with the corona into, I think everybody knows a lot about viruses and vaccines. So certain areas are still untouched which are very, very important. So cancer cervix, if we look at the status in India, India is the capital of cervical cancer. It is very, very unfortunate that every woman is actually at risk of cervical cancer, and unfortunately 20% of the cervical cancer burden all over the world is taken by India. So 1 out of 5 women who die due to cervical cancer in the world is an Indian. Death due to cancer cervix is more than pregnancy deaths. So one death in 9 minutes is happening due to cervical cancer. So it's very important that we all know about, and most important is that it's 100% preventable. All we need is awareness. Like I told you, that old lady who came, and it happened last year, 3 patients in row in 3 days came with full-blown cervical cancer with no symptoms, and we had hardly anything to offer them. So cervical cancer in India, it's a preventable tragedy that requires urgent attention. It is estimated that in India, about 160 million women between 30 to 59 years of age are at risk of developing cervical cancer, with fatality rate of 50%. It's more than 50% actually. So legends words never die. Louis Pasteur, we all know. He has said, why talk of cure when we can prevent it? So he is the father of all the vaccines which were generated earlier. So we have to remember one broad thing, that this is one cancer which is so dreaded and so deadly, but it is 100% preventable. And what is the remedy? HPV vaccine forms the base of cervical cancer control. So primary prevention vaccination, if given and followed by all the screening tests that we have been doing, it can just stop the cancer cervix altogether. So we have the next slide. Protection from HPV cancer is priceless. Looking at the price that a woman pays by not getting protected, it's her health, her life is at stake, and the monetary and financial constraint on the family. And then the life after cancer cervix, it is so miserable that you have to witness to work on it. So our one conversation may help save a life. So it's better to talk about the subject here. Cancer burden in 2018, if we look at the scenario in India, there were 1.16 million cases and deaths were 7,84,800 deaths. So among the 6 leading cancers, after breast and oral, cervical cancer has taken almost 97,000. It has affected 97,000 lives. And in man, other cancers like oral, lung, stomach, colorectal, and other cancers accounted for 45% of cases. And in women, breast, cervical, ovarian, oral, and colorectal cancers account for 60%. Out of these, cervical cancer is 100% preventable. So we need to focus our attention on this. So does HPV cause only cervical cancer? There are 2 issues. Does vaccination against HPV can prevent cervical cancer? That is right. But does HPV cause only cervical cancer? No. Why HPV disease need to be prevented in India? So let's have a look at other slides. HPV is the necessary cause of cervical cancer. That's what I said. But other cancerous lesions around anogenital region and oral mucosa, besides erogenital walls and respiratory papillomas. So what is the global incidence of all the cancers? 100% cervical cancer is by HPV, 70% vaginal cancers, 43% vulval, 50% penile cancers, 88% of the anal cancers are because of HPV, and then oropharyngeal cancers including tonsil and base of tongue. So we are preventing all these cancers by giving HPV vaccine. So that makes it important vaccine not only for females but for males as well. So what is the aim? To eliminate cervical cancer, but in how many years? The pace at which we are going, we may not be able to eliminate it for next 500 years. So WHO is making strategy which are critical and effective, and aim is maybe in 100 years. WHO has made policies to eradicate it by 2030. But maybe the pace at which we are going, we will not be able to do it. So
let's have a look at what we are doing. What India should do to eradicate this. Most important remains the vaccination. So 90% if are vaccinated and 70% population if we are screened, then 90% will be treated by 2030. That looks like a far-off dream. Vaccinating girls against cancer-causing HPV before 15 is the foundation for bringing every country's incidence rate of cervical cancer down. So scaling up screening, we had recently done a screening camp where we had done massive screening. Around 1,500 females were screened for cancer cervix, free of course. And awareness had gone to almost 50,000 females, because it's just 3% of the females that we are able to screen now. So it is very, very low. So we have to increase the vaccination drive. We have to improve the screening. And then maybe by 2030, we will have 90% patients treated. Next. So this is one of the glimpses of cervical camp which was done at Rewari by Obs Gyn Society. In the next, the whole queue of all the patients who came, and they were really aware about the disease. And this is the World Health Organization strategy that they want to eliminate, and they aim to set the world on the right track by 2030. At this pace, global elimination of cervical cancer is not predicted earlier than 100 years, the pace at which we are going. So if no action is taken, cervical cancer deaths will almost rise by 50% by 2030. So this is need of the hour, calling that we have to do something about it. Elimination of WHO says that elimination is possible within the lifetime of the today's youngest girls. That's 11 years is the cutoff that we've taken. 9 years, they say as early as you start vaccinating, more will be antibodies, better will be immunity and the eradication. But the clock starts now, and every intervention counts. What we are doing right away also matters. What is the status of vaccination in India? See, India, we are still a developing world, and vaccine is still very costly. So less than 1% of the eligible women vaccinated with HPV vaccine. Moreover, the awareness about the vaccine, about the side effects, about the paranoia of us that whether it is effective or not, we as gynecologists were also not prescribing vaccine to children because it was under trial. But now since 2006 to 2022, enough trials have been done, the side effects have been reported, and we feel comfortable that it can be given, though cost remains the mainstay. So cervical cancer screening practice in India is that cervical cancer screening is merely 3.1% in the general female population, which is very, very low. Next. Cervical cancer is one such fatal but vaccine preventable disease, and more than 60,000 females lose their life because of cervical cancer in India. Nearly 40% of the patient age group 40 plus reproductive age group, and less than 1% population immunized against cervical cancer, and screening rate is as low as 3.1%. So what can we think of the status? Next. Recommended, what is the schedule of HPV vaccination? See, best age is 9 years. In India, though our girls don't start mixing up with boys, and HPV is not totally the sexually transmitted disease. It can happen with deep skin contact also. And recommended is that 9 to 10 or below 15 if we give maximum immunity and best results. 2 doses are recommended, and it has been recommended by WHO, CDC, FOXI, API, all our major organizations of India. They recommend the 2 doses before 15 years and 3 doses after 15 years. And age which has been taken is from 9 years to 45 years. That is active sex life of any woman. Next. So how good it is? We give one vaccine, 2 doses, and there is protection against 6 types of cancer. So pediatricians call it cancer vaccine because all the vaccinations are done by pediatricians. So they call it cancer vaccine because it is preventing against cervical, vulvar, vaginal, endometrial, oral cavity cancer, and anal cancer. Exposure to HPV at a young age increases the risk of cervical lesions and cancer in women. More than 5 times higher risk of invasive cancer if first intercourse before 18 years compared to after 20 years. And that is the irony that in our country still marriage less than 18 years are so common that incidence is still on a higher side. So why protecting boys against HPV is important? This is another issue that came to my mind and I thought of sharing with you. HPV prevalence among men in India is 26.7%. And all the more, it's almost 66.7% in the cohort where their spouses are suffering from cervical cancer. So why male vaccination is important? Because for females, we have capped our age, that 9 to 16. But here males remain susceptible to HPV vaccine infection throughout their life, and high prevalence rates of infection across all age groups, and cancer risk is also increased, and gender neutral vaccination program increase the protection. So males are more susceptible to new and recurrent infection also. And moreover, we don't do any screening for male population as such. Only in our infertility clinic, we do semen analysis and a culture. So they are at high risk and need to be vaccinated. Next. To make significant, see how many type of HPV viruses, that is human papilloma virus we have. Most dangerous and dreaded is 16 and 18, then 6 and 11. So earlier we had bivalent vaccine, then we had quadruplet, and now we have 9, that is Gardasil 9, or we have Cervarix. So to make significant impact on HPV disease burden and cancers, broadest serotype coverage is required. So we need to cover all the viruses if possible, or covering these 4 major, that is 16, 18, 6 and 11 also helps against the cancer. So 9-valent HPV vaccine, a new leap in India's journey towards protecting life from HPV-related cancers and diseases. Next. CDC, Center for Disease Control, advises not to only rely on cervical cancer screening, but to protect women with HPV vaccination now. And this is the only cancer where there is recommended screening test. And pre-cancer for other HPV-related cancers except cervical cancer may require invasive testing and treatment. Cervical cancer requires very simple basic screening. 90% of HPV cancers are preventable with HPV vaccination. Postpartum vaccination, we will be discussing about this in detail later also, that postpartum, that is immediately after delivery also, when patient has come to us, we can vaccinate her. We have to look for the target population, and it is not too late because HPV does not discriminate age. The virus can occur, it can infect, and the infection can occur at any age. So HPV does not discriminate any age, and so between 9 to 49, anytime we can give it. Next. Risk of progression from CIN, that is stage 1 to stage 3 neoplasia, is 7 times higher for women more than 30 years. So if the age is more, then also we can give it. There is no limit that 30 you cannot give, 20 you have to give. But the risk will be increasing for cancer with the age. Next. So the vaccine is efficacious even in mid-adult women also. That is what we conclude from this. Next. Do I need to vaccinate my patient if she's already positive for any HPV serotype? Yes. As I have told you that there is a whole variety of human papilloma viruses. And next slide. It may not be possible. The chance of a woman being infected with all 4 types of HPV included in quadruvalent HPV vaccine is very, very low. So even if patient has been infected earlier, it is always better to vaccinate her. So majority of the sexually active women can get benefit from HPV vaccine. Patients are concerned about the safety. This was my big concern when I wanted to give it to my daughter. So how do we get that assurance? Now, the vaccination started in 2006 and it has been 16 years almost. And the results of 7 phase 3 trial studies on more than
I think 30,000 subjects. They say the safety and efficacy of vaccine was established in a clinical program with 7 phase 3 trials, and safety has continued to be evaluated in several large groups, and all the studies find that this vaccine against HPV is very, very safe, looking at the risk and the benefit ratio. And this is the review by all the world fame organizations that positive HPV safety profile by health authorities for the vaccine, and more than 300 million doses have been dispensed worldwide since 2006. So this data is till 2018 only, and WHO, FDA, TGA, if you go, everybody says that this is very, very safe and effective vaccine. So CDC and WHO have recommended it for use. This was topic of my concern because earlier studies had shown that the ovarian reserve was affected badly by the vaccine. There were some studies which came up and which were withdrawn later on because anything that needs a long-term trial. HPV vaccine, they concluded that there is available data do not support any association between vaccination and infertility or proven ovarian insufficiency. Next. So these are the various studies which say that quadrivalent or bivalent, all the vaccines are very, very effective. Actually, we are now using 9 HPV vaccine, which is Gardasil 9, and that is very, very effective, and it gives protection against all the Cervarix, giving that protection against cervical and vulval cancer. Genital warts are not protected by bivalent. We need to give them quadrivalent vaccine. So all the lesions are protected with the cervical cancer, vulvar cancer, vaginal or the anal cancer. They get protection by HPV vaccine. So it is must that we vaccinate both male and female population. Is it safe for lactating mothers? Yes. All ACOG, US CDC and WHO recommend that breastfeeding is not a contraindication for HPV vaccination. Available evidence does not indicate increased risk of adverse effects linked to the vaccine in either the mother or the babies after administration. Next. Patients are concerned that the disease happens in the later stages of life. Then does the vaccine have lasting effectiveness? Do we need any booster dose? No. Vaccine has proven effectiveness that it provides long-term protection. There is zero breakthrough even after 10 years of vaccination. So there are no cases even after 10 years, and it has a everlasting immunity. So if I complete the vaccination schedule and if it is delayed for certain reasons, then what? This is another question that comes to our mind. So vaccination has to be completed. If the vaccination schedule is interrupted, doses do not need to be repeated. There is no maximum interval, but it is better that it should be done within 1 year if 2 doses are taken, and if it is not done in 1 year, then 3 doses schedule is to be followed. All 3 doses should be given within a year period if possible. So 2 doses schedule, if we are starting at 9 years of age, we can finish within 3 years. Next. So 4 reasons why we should take HPV vaccine: that it is effective in mid-adult women also, proven effectiveness, that it provides long-term protection, and it is safe in lactating mothers, and it assures a safety profile. And when we are protecting female, our goal should be not to miss single adolescent girl, the advantage with less cost. While protecting girls, the parents should consider vaccinating adolescent boys also between 9 to 15 years of age. Next. A little about HPV virus. This is human papilloma virus. Is the causative agent, and genital herpes is a very common sexually transmitted infection. Almost all cases of genital warts and cervical cancer are due to HPV. HPV causes some other genital cancers also, as we have already talked. Next. Not necessarily that we get it by sexually transmitted, it can be by close contact also, and condom doesn't protect us against HPV. Next. So it can go to a person through tiny invisible breaks also, and it can cause genital cancers and warts. Condoms offer little protection. And however, condoms do protect against other sexually transmitted infections and help prevent unwanted pregnancies. Next. Usually HPV, this infection happens to almost 90% of the females, but virus leaves the body naturally when your immunity is strong. But sometimes it doesn't leave the body naturally, and that is called persistent infection. And any viral infection which is persistent, it can cause abnormal cells, more so for HPV. And abnormal cells can develop into cancer, usually over many years. So is the role of vaccine. So as we have already discussed the vaccine, that before 15 years, we are giving 2 doses. After 15 years, 3 doses at 0, 2, and 6 months interval. If we are giving 2 doses, it is 0 and 6 months interval. Next. HPV vaccine is safe. Some people do experience mild side effects such as pain, redness, or swelling at the injection site. However, this is very normal and symptoms go away very quickly. Works best when it is given at 12 to 13 or before any female becomes sexually active. Everyone knows about the mechanism, how vaccine works. So one positive thing that we have learned from COVID, that whenever the vaccine is given, body makes antibodies in response. And if when exposed to real virus, again, antibodies can clear it from the body. This is called immunity. Next. How successful is the vaccine? We have already talked about it, that is very, very successful in preventing the cancer of cervix and the warts. Once the disease has happened, it may not be really effective. Next. Yes, once you are vaccinated, you still need cervical screening test because vaccine does not protect against all the HPV types that can lead to cervical cancer. The most common 9 we protect by 9, or the 4 we protect by 4, but there are still more variants which can infect. One needs a cervical screening test every 5 years from the age of 25. Next. So all females and males will be infected with at least one type of HPV at some point in their lives. So better to get vaccinated. Next. We can skip this and go to next. So this vaccine is very, very effective. This is a recombinant vaccine, which is non-infectious and non-oncogenic and produces higher level of neutralizing antibody than the natural infection. So we are vaccinating today so that our children will have the best protection possible long before the start of any kind of sexual activity. Like we do for our newborns. They are exposed to an injection, as the case with measles and other BCG and other injections. Similarly, we want to vaccinate children long before they are exposed to HPV. But the funds and the economy remain the constraint. Then, next. We have already talked about these 3 vaccines, which we are giving 3 doses and 2 doses schedule. So we read the recommendation by our own Indian Academy of Pediatrics that HPV vaccination is of public health importance. Compliance with cervical pap smear screening is still very, very low in India. Currently available vaccines are very safe and effective, and IAP recommends that offering vaccine to all females who can afford the vaccine, it should be given, because protection is seen only when the vaccine is given before infection with HPV. So the vaccine should be given prior to sexual life starts. So this is again the summary of the schedule that we have to give: 2 doses before 15 years, after 15 to 26 years, or 27 to 45 years, 3 doses. Next. So HPV vaccine is safe and effective, but the HPV vaccination rates lag well behind those of other vaccines recommended for children and adolescents. Understanding the barriers to HPV vaccine acceptance and effective strategies for overcoming them will improve vaccine uptake and completion in adolescents. So HPV vaccine is the best way to prevent many types of cancer. HPV vaccination is recommended at ages of 11 to 12, and HPV vaccination is reducing HPV disease definitely. So more the awareness, lesser will be the toxicity and the disease burden on the country. So next is, thank you very much for sparing your time and patient listening. And I will now request Neela Garg ma'am to talk on the subject and highlight and tell us about the issues that we have missed in the talk and what WHO has to say about this. Over to you, ma'am.
Yeah, thank you, Dr. Seema. Actually, it took me back to 1986 when we were doing feasibility of involving existing infrastructure in detection of precancerous and cancerous lesions of uterine cervix. One thing which you have to remember is that our country is very big with a population of about 1.4 billion people. We have to look at, from a larger perspective. You rightly said that, the WHO recommends, 2 doses of less, of the vaccine when you are less than, 15 years of age, and 3 doses when you are there, more than 15 years of age. But what is more important is also you have to talk of the preventive strategies. Number one is that, when you talked about the age of marriage of less than 18 years of age, the second part is that we need to also talk about the safe sex issues. Now we have got what are the important platforms where we can talk? Are the, adolescent friendly clinics, or we can talk about, in the at the school platforms, because this is where we can catch the cohort of people and we can give the vaccination also. But it is very, very important to talk about safe sex. That is where an empowering girls and boys, that is very, very important thing. And any, unusual, blood stain discharge or, multi-partner sex, which has become a part of life. So you have to talk about the preventive strategies along with the vaccination that is going to complement, and that is how we are going to overcome. Another thing which we have to remember is that India is huge. Pap smears is not possible. So in my own experience, earlier we used to say that after the age of 35, get screening done every year. You have recommended that 5 years also, you do the screening after 25 years, every 5 years. But it is important to remember that we are very short of cytopathologists, that is there. So, the answer which remains with us is that one-time lifetime screening is sufficient, but at the same time, we continue training our paramedical workers as well to do the visual inspection of cervix so that, we can focus on clinical downstaging. But as of now, I will always, appreciate that if from this platform, the recommendation can go that, it should be a part of, we are only going to be successful in our strategy when this becomes a part of our national immunization program. So that is where, some of the, institutions across have started vaccinating nursing students, medical students and all, but this is not a universal phenomena. So from this platform, if the recommendations can go that, if this becomes a part of universal immunization program, then, it will be very, very useful to have, a vaccine which is accessible, because we do have a very good even platform, which, already has been utilized for giving COVID-19 vaccination as part of COVID platform. So we can use this platform for giving this, but WHO's recommendations are very clear, but we have to be clear amongst ourselves. That is where the intellectuals have to come together and see that when we are giving this vaccine, as you rightly pointed out, that this is going to protect against 6 cancers, not only, when we are talking of cervical cancer, but vulval cancer, vaginal cancer, or 3 cancers in males. So it is very important to empower and sensitize our own communities, have many roundtables amongst I think it will be very important if from this platform, the lead can be taken that, we have got strong recommendations, from the pediatricians, from the obstetricians, from the public health experts, that this is the vaccine which is the need of the hour, right? So this is where we need to promote HPV vaccine and make it a part of our universal immunization program. That is there. Another thing is that we also have to see that how feasible and how effectively we can give this, because for children we have got well steamed this thing that they can come after 6 weeks, 10 weeks, 14 weeks, and at 9 months and all for the universal immunization program. So we have to see the strategies also, how we can make it universal. So one platform we can see is a platform of, if we have to go for universal health coverage, we have to use the platform of health and wellness centers. Until now, we have established 1,17,000 health and wellness centers. Even, Foxy can train the community health officers, who can be the messengers of change, where, from that platform, the vaccine can reach the last mile. Because ultimately we have to see that, who are the ones who are indulging in unsafe sexual behaviors, where, the age of marriage is common at less than 18 years of age. People are coming with, unhealthy discharges and all, but they're not aware of. So awareness creation is also very, very important. Plus empowerment of our paramedical workers is also very important. This is what we realized, when we were doing the, agreement levels between the, and you can please do this, that please do the agreement level studies between yourself and the paramedical workers, because they can diagnose an unhealthy cervix to the tune of more than 95%. But then, as of now, the need of the hour is to promote this vaccine along with the correct message of other preventive strategies as well. And then the third part is that we have to be very clear that pap smear is not going to be, a feasible option, because we do not have that many number of cytopathologists as well. So as far as, WHO recommends, we have to go by that, and we have to put it as a part of this meeting. Will only be, will be more meaningful once, it becomes, the vaccine becomes a part of our national immunization program. So thank you so much for organizing this meeting. And it's a very, very important public health perspective. As I said, I started in 1986 with this whole option that how do we involve, everybody can take, look at the cervix, make it, kind of, they can, make out whether it is unhealthy, healthy. We can go for clinical downstaging. And then, subsequently, it is important that it should be a part of school curricula itself as well. When we make it a part of school curricula, that these are the vaccines which you are telling them about children, but we can tell them about, what is the, how do we empower them, what our youth, that this is their vaccine. So this is where, they will go and sensitize their parents also, so that we can go ahead with this vaccine, which is really the need of the hour, because we can deal with 6 cancers at one point of time. Thank you so much. Thank you.
Thank you, ma'am. The Herculean task that you have been doing in public health, we really need inputs from you. And we will once again get back to you so much. We owe you, ma'am. We got up at 7 a.m. in the morning from US to just
Thank you.
enlighten our audience. And now I switch over to Dr. Sadhna Gupta. Sadhna, ma'am.
Yes. So
Yeah.
good evening to everybody, and a hearty thanks to Dr. Seema and a wonderful presentation. And my deep regards to all Rewari Society member, Dr. Sunila Garg. I'm really impressed with her in-depth observation and a long association with all these things. And this is what we owe. And Dr. Anita Kant, Faridabad Obs Gyn Society, and Dr. Pavitra. So very, very important thing Dr. Sunila has actually pointed, that we must be clear among ourselves. So this is very important. While the Foxy as well as the Indian Academy of Pediatrician has already advocated that with the bar that when it is financially feasible. So to me, there are 4 points. First is the communication, like awareness on the both parts, people as well as the healthcare provider. It includes like from expert, OB-GYN, as well as extending to all ANMs and the paramedical workers, that they are aware of this visual examination and the so much wide presence that the CA cervix is just around us. And today, Seema, that like Anita, we will say that people don't want to do OB-GYN, don't want to do perispectrum examination, and the patient doesn't want to lie down. We can have a number of ultrasounds. So a lot of issues among ourselves. So first is the communication, and second is a very, very important part is the cost. And we cannot, Dr. Sunila has already said the stage that it is 1.3 billion population we had, and the HPV vaccine is still a costly affair. And somehow we could not have that strong advocacy like the government did for the COVID vaccination. And we really had free and a very low cost COVID vaccination for our whole population, and we can be proud of it. As a Foxy level, as a IAP, as a for many fronts, we have to have a very strong advocacy for the cost and inclusion in national immunization program. And with this, the association of Gavi, that the UNICEF, which is working on availability of the low cost vaccine to the developing world. And why I'm saying, as a being a Foxy representative to South Asian Federation and a co-chair, Bhutan has been like successful in giving 100% vaccination. And likewise, Bangladesh and the Nepal, when there are few projects when they could achieve 100% vaccination, and that actually emphasized the international association. We have to be together, Gavi, UNICEF, WHO, our government, and our professional bodies, that it is available at the low cost, at the lowest cost possible, because what it is a costly thing. And from where we are getting most of the CA cervix from the rural people who are not getting, who are that like residing in low socioeconomic slums area, professional sex worker. So we actually, they are not able to afford. We can provide into the like a high class, high socioeconomic class schools as a obstetrician, but actually we have to reach. So communication, cost, and the third thing is because in the initial phase in India we had a few controversy about side effect, and Dr. Seema, I congratulate that you in presentation take a good amount of safety coverage, because we must be very confident about its safety. Now it has been 10 years and it has been included in the US and the many countries immunization program. So there is no issue of any long-term or a short-term safety. That communication and the monitoring has to be like there, because why there was confusion, because there were 4 unrelated deaths, but the all research was simply stopped, and we were like lagging behind around 5 to 10 years, and no one was able to speak on the HPV because there was something. So monitoring in COVID, what we had, we can really had a now good experience. We observe and every side effect through the internet. So we can use a very robust information technology. And the fourth thing, what we'll say, that the cold chain. What is cold chain? Means whole system of delivering the vaccine. Because vaccine is something that once we have certain that after 10 years, there will be question that we had HPV vaccine and there was something CIN or the cancer cervix. So creating a robust system right from cold storage for the good application, and the safety issues, like WHO recommends that every person should be observed for 15 to 20 minutes after vaccination. So that protocol has to be like followed, and we can be very successful if we like empower all the 4 that is advocacy at the level of people, at the level of doctors and healthcare providers. Then the cost, we have to be very, very strong together, because now the serum, it is not only Cervarix and the Gardasil, because we have that, we can make the India is will be the, we can see a lot of business and like a real stand, because the India is a top manufacturer in vaccine, and we can go together, like we can improve our economic, and we can improve our women's health status. Then this thing cold, and the cold chain, what we say, the quality care, what we say, the all the things in the system. And these are the 4 issues where we have to work together, and we have to reach the unreached. And this can only happen when it is included in the national immunization program. And we have to be, like Dr. Sunila said, and you have also said, that it should be the part of positive reproductive sexual health. If we say it is cancer, then people are afraid. If we say it is related to sexually transmitted infection, then they say it is something blame on us or something. You know, in India, still we don't find good that somebody says that your adolescent girl or boy is sexually active or something. So we have to relate to it a positive reproductive and sexual health. And about boys, I think at the moment for the few years, it is considering 1.3 billion, we have to focus more on the girls, because even in Western world, it is not been possible to vaccinate the boys because of cost. So we have to be population specific so that we can really target the specialized population group. And again, around 45 years, again, I issue, we can say one message that 9 to 15 best time, 14 to 26 catch up time, and after that it should be individualized, and we cannot say general message that every woman like in 40s can have HPV vaccine. I think we should not do it. It is an individualized decision of the clinician, but it is 9 to 13 and 13 to 26 catch up. So we are on the same page and there are no controversies, and that will make the effective use of HPV vaccine. So thank you. It is all what I have to say. And once again, congratulate your passion and your wonderful presentation and your commitment for this very, very important public health issue. Thank you for opportunity.
Thank you, ma'am. Very well explained and expressed. Actually, that was our concern, that where the vaccine should reach, it may not reach for further 2 decades because they're the poor and the underprivileged. Because from the high socioeconomic status, they visit the doctor also, they get examination done also. And moreover, on our part also, we most of the time miss the examination, which should be ideally done. And you have really mentioned that risk group, that more than 40 years, we should not, I mean, we have to individualize, but till that age, the 26, up to 26 is the target population that we have to keep in mind. So ma'am, we will be here for more inputs if we have any questions from the audience. And we now invite Dr. Anita Khan, ma'am. Ma'am has been into practice for, I think now, 4 decades almost. So Anita Khan, ma'am will share her experiences on HPV vaccine. Anita ma'am, are you there, ma'am?
Yes, I'm there.
Right,
Dr. Seema, as it seems, I'm working in the corporate sector, and I think I'm more privileged than where the actual problems are lying. But today morning itself, I saw such a huge growth on the cervix in a very affluent family lady, and she was having problem for the last 3 months. She did not go anywhere. It really brings tears to your eyes. She could have always been told about vaccination. On the other end, in the youngsters, I'm finding that magazines are writing a lot about all of HPV and cancer and these vaccinations. And the mothers, they come, they want it for their daughters, for themselves, and they also say कि अभी एक 9 वाला आया है, let's go for that. They are willing to shell out money for that, and we play on it and we tell them, okay, this is the distributor, go buy, this is the schedule, our nurse will give it to you. But somehow there are certain pediatricians still in my city who are not encouraging it, because somehow they feel that it is really not required to spend so much of money, and till it gets included into the national program, they will not be recommending it. These are the 2 things I wanted to point out, that the rich people and the educated people today know a lot about it. We just need to tell them, especially those who deliver, like ma'am said, Sadhana ma'am said, those who just recently delivered, they will be coming to the hospital time and again for the baby's vaccination. They can join this vaccination of theirs with it. If they have a younger sister or a sister-in-law, she can be vaccinated with them. And of course, for their daughters, so we always counsel them.
Ma'am, are you recommending it in as a routine to all the youngsters coming to you?
Yes, I'm telling it as a routine to anybody who comes for premarital counseling, pre-conceptional counseling, all the postnatal mothers, all the young girls who come for any reason to us, and also whoever asks us till the age of 40. Although I remember attending a meeting with Dr. Sharda Jain, and she had said, why, if a 60-year-old wants it, what is your problem? So there are so many inputs I'd like to share, but yes, we are, whatever little bit, maybe a drop in the sea, but at least I'm trying to do it to let people know what it is all about. Koi na koi jaake, they spread it to their friends, and more people will come back for vaccination. Those who can afford at least can now join in, in the vaccinated group. Later, let's see what the government does for us.
No, I think Dr. Seema, Anita has made a very right point. And also I was listening to Dr. Sadhna that from this a communication can be sent to ICMR journal, that this is how the recommendation of the group is there, but this can go as a communication. So this is what the group has a perfect combination of the obstetricians. We can take the view of, there's a public health expert, where I am present there. And also, we can have comments from the pediatrician, because ultimately it has to have a holistic approach. Then only we'll be able to reach the last mile. So I feel that it becomes very important at this point of time that we need to, kind of take this agenda, not stop over here. Carry on with these meetings at regular intervals, but carry on, let the, organizers prepare a small communication which we can send to IGMR journal, so that this will have an impact as well. Thank you. And cold chain is very, very important part, which has been pointed out, which also we will include in that, that is another thing. Thank you.
Thank you so much, ma'am, for all the important inputs. Actually, ma'am has talked about the ocean and the drop. I think each drop matters in the ocean. And we have, like I said, Dr. Pavitra Rao, ma'am. Dr. Pavitra, have you joined? We had connected with the Lioness Club and the schools also we tried, so that we can reach to them. And that's why we have called Dr. Pavitra Rao, because she's a perfect bridge between the community and the service providers. So, ma'am, there are two questions till I find out if Pavitra ma'am has joined or not. And this question is from Jagrati Sangvi. Is it advisable to give vaccines after sexual exposure? So, Sunila ma'am or Sadhna ma'am or Rita ma'am, anybody can answer, ma'am?
Yeah, definitely one can give. Yeah.
I think we have discussed about it already, that it can be given any time, and even after the infection also, if it has happened, because it may not be that vaccine has covered all the infections or all the infections.
But also for subsequent this thing also.
Right. And there is another question from Dr. Chandrakanta Sulani, that if a patient 35 years old having got treated for same now, patient is seeking for HPV vaccination, what to do? Patient she's treated for warts and now she wants vaccination for HPV. Sadhna ma'am?
Actually, as far as science and the general recommendation says, again, I will say it is 9 to 15 and catch up to 26. Now, what Dr. Anita is saying, that they have that you can give up to whatever age. And what happens if the patient is having infected with HPV and they feel that it will somehow affect. So again, we can say that it is now not that effective. We have to be very, very transparent that because you have been already infected with HPV, so it does not have that effective. But if you want to take add-on, an add-on, that should be the patient's perspective. And if she is really willing to have vaccine, then there is no reason that we withhold it. That's my
But I also agree with that.
Yes.
Because it may not be that every HPV has infected her. So let us give her a benefit of doubt.
So the third question by Dr. Jagruti again is, till what age is it advisable to give vaccination? So that has also been covered very well.
Yeah.
Actually, after 30 or 35, we cannot say that every patient who walks into our clinic and we advise HPV vaccine. Right time is the right time, but if the patient is concerned, she has knowledge and she has a question, then we can offer, and there is no harm or adverse effect that we can assure it is safe, it can be beneficial, and then it should be individualized. But every patient who is walking in our clinic and we offer vaccine, that is not advisable, because we have to focus on the real efficacy and what is our population target. That is my takeaway. And Dr. Sunila is covering on it.
So, ma'am, what are the side effects that you have come across, ma'am? Because earlier we came to know that there is literature saying that there is ovarian failure in patients who had taken this vaccine. The studies came up and then they were taken back suddenly from the journals. So are there any side effects in acute
Actually, first, what we have, it is nothing except a little bit pain at the site of injection. I have not come across, but Dr. Sunila, I will like to have your comment. The one Japanese journal who says about something about cognitive or something. So what's your takeaway and that incident that has caused? I have not encountered any side effect, any sort of side effect with it.
See, that is what I say. And this was true when we saw in cases of COVID-19 vaccination also. If to the tune of, 0.0003% or something like that. But, a return on investment is much more. We will definitely have to promote the vaccine as compared to, one odd side effect that is that can be taken care of, because we have to look in the larger interest. What is the benefit of
and
the vaccine?
quality services are very important, like cold
Yes.
chain, good safety technique, deltoid, whatever it is, and observing. Still, WHO says observe every person up to for 15 minutes after injection, and if we follow this protocol and monitor even a small side effect, that will actually instill confidence, and we can have this data of the safety. So this is very important, and we have to assure the quality services. That is also the part and parcel of the...
Like you said, I'd like to share an experience with you. I had the whole female staff of my hospital vaccinated sometime back. It is about 5 years back or so. And one doctor in the evening threw a fit. That was the first and the last time that she's had a kind of epileptic grand mal seizure. But there's no literature anywhere. We've read a lot, we've written a lot to the company, found out from all over, but it happened. So that was one thing that I would like to share.
This is important, actually. It is to be reported.
We have written to the company. This is long time back, but we had written to the company.
Because this is where every event, adverse event following immunization needs to be documented, and so that we can prove for the cause and effect.
Yes.
And likewise, one thing in the how we can reach the target population. Adolescent now, they are coming in a good number 10 years before, but still large proportion when we go to schools of the different socio-economic, I really always say that, oh, we are not reaching to them. And sometimes a girl comes after 15 years that I did PMT examination when you visited my hospital, and the mother says that she has started drinking milk. So when we start, if we start any community vaccination program in a school program or in rural panchayat and something, then we have to be very careful about counseling of the parents, taking confidence in the teachers, and like all the things, because that is the way where we can reach the unreached. What the people who are not coming to us, we are going to them. And that again, a very strategically organized camp approach, taking confidence of parents, teacher, quality, paramedicals. That should be the other way which as a society, as a Obs Gynae society, we can do in our in our cities, because teachers are sometimes apprehensive. Even we want to give the hemoglobin, they say no, we don't want to take responsibility if something happens. So here we have to break a lot of walls and the barriers, and when we will start having such program in a loud voice, then only their confidence will be there. That the girls are a little different, and they need something for positive report, like rubella vaccine. It is one thing, and then HPV vaccine, which is much more which can much more beneficial consequences.
Ma'am, I'm associated with certain education society in Faridabad, and we are running 16 schools and a degree college. But when I started telling everybody we do go for menstrual health, mission bring health and all that, but their problem is money. Parents don't have that kind of money. So unless the company people say, they say we can't provide at a lesser rate, so therein is a big drawback.
So many times the girls come to us, तो फिर कहते नहीं अभी we will take medicine, and not now, बाद में देखा जाएगा, we will see. So cost is the very, very big issue. That's why Dr.
But Dr. Sadhna, like, I remember that this whole issue was there during COVID-19 vaccination also, where, people stood up at large, many resident welfare associations, they came forward. So we have to look at that, we have to look at involvement of, Confederation of Industries. We can write to, from this platform, you can write to FICCI as well, so that some of the schools can be adopted and that vaccine can be given to them. So we can, that's what I was telling. Power of writing is that this is where you can create a not only awareness, but you can create an intervention where the girls can get this vaccine. And ultimately, I feel involvement of the boys is also going to be very helpful, because then they learn. When we talk about reproductive health issues in isolation to the girls, I feel involvement of the boys is equally very, very important, so that it serves as a double kind of a strategy. They understand the reproductive health issues, they understand the concerns, they understand the concerns for themselves as well. So I think it is also talking about, in a way, about, safer sex issues as well. And, taking care of the, understanding the needs from both the perspectives. So I feel that we should, involve whatever platforms we can for the availability of the vaccine. And, the Confederation of Industries, RWS, can play a very critical role. Then again, we can approach, to the local health missions, state health missions, where they have the program, under the program implementation plan for cancers, for NCDs, there is a budget. So they can put in, nothing stops them for putting in for the vaccines. So that is where there's a lot of scope, and we have to see that how we can reach exactly. You have been talking about last mile, and this is my most favorite thing, that the lady sitting in the last mile of, Jharkhand should be, or a girl, should be able to get the vaccine. Thank you.
Right, ma'am. That was the purpose, that we outreach the people where nothing reaches. And I think we all carry the same sentiments. There are two more questions, but I think we've answered all the questions. So this is the question from Dr. Chandrakanta. How do we monitor after HPV vaccination? Do we do the titers, antibody titers, anything, Sanna ma'am?
I think she's one point is a monitor, like putting the patient into like a observation for 15 minutes for vitals or any reaction or something. And the antibody status, it is not recommended either doing before HPV vaccine or after HPV vaccine. Only in the research project and the research setting they are doing the antibody titer, but in the clinical setting, neither before HPV vaccine the antibody titer is like recommended, or nor after HPV, because it has got something, a localized immunity and a localized issue. It is something different from other vaccinations, so it is not recommended antibody status. And 15 minutes for all vitals, allergic rashes, any drops in anything, any adverse effect. So 15 minutes. And what Dr. Anita say, we can say that be careful for 1 day also, because with any with the experience if we have. And
you see, and even and I will say that let the lady be, or let the parents be cautious about watching for 29 days. That is important. But, first day is very, very critical. But even within a month, if she notices anything, she or he, they notice anything abnormal, should be brought to the attention, because, we have still not launched it at a mass scale. So we are still in dark. So your point is very, very valid, that immediate observation, which we have, kind of stopped doing in our routine immunization clinic also. So this message should serve for that also, that every child who is vaccinated also should be observed. That is important. Thank you.
Ma'am, very important question that has been taken by Chetan Ramaya. HIV positive patients and vaccine, where we have not mentioned actually anywhere that 3 doses are to be given. So ma'am, elaborate more on HIV patients and HPV vaccine.
That should be given to this thing. And then basically there's no this thing that for HIV patients rather, because wherever there's compromise is there, at that same time, the vaccine is definitely going to help. So for HIV patients also, this vaccine needs to be given, because this totally, when we are talking about, in context, and we are also talking to them about the safer sex issues also. And those patients also, it will depend on what stage of HIV they are. That will be important. But if there's a young individual who is HIV positive, and, between the ages of, let's say 10 to 19 should be given. That is there. But when we talk about 35 plus, we have to look at, basically not only the cost-effective intervention part, but we have to look from the feasibility part also. And we have to look from, as I said, always keep on talking about the return on investment. Whom will you prioritize? That is there. The message definitely has to go to, even from this platform, to the AIDS Society of India, where Dr. Ishwar Gilara is the president. We can write to him also that this is the recommendation of this group, that HPV vaccine should be given, and Infectious Disease Society has also recommended that.
And they should be given 3 doses regardless of the age. If the patient is HPV positive, they have to take that 0 to 6 months of course.
Yes.
Sadhana ma'am, you want to add anything to this question? This is important part of the list.
I think we have put few questions and few really implementable things to our society. And in HP, what HIV patients are high risk patient for cervical cancer as it is. So they can, but it is a priority, and that even if they are a little higher age group, about 28, 29, 30, then HPV vaccine should be recommended as far as the science says, because they are more prone to have the carcinoma cervix as well. So it is good. I think it is a thing which we can do, especially for the individual person. Dr. Sunila also says the same thing. I think.
And another question from Dr. Mansa: do we need to do HPV DNA test or pap smear test before giving vaccination to adult women? We don't need,
No need.
No.
Because it is 100 types of HPV actually genes, HPV DNA, so there is no need, and that makes the thing more complicating, and it is a dire need of time that we make simple thing and specify our population target. That is the thing.
And we are not talking of research. You see, one should differentiate between a public health program and research. You see, in research, you can do, on a smaller sample, but then, already we know that the research has been done. So it is an effective vaccine. So we need to now take it to the masses. That is the need of the hour.
So, ma'am, I think we have discussed that we have to reach the outreach, and vaccination is must. Screening programs should be done, and we need to discuss more on these platforms. And I think all the questions also we have answered. Any other question? There is no more question. So
one question in the chat box.
What question? Deepa, you can read the question.
If at the age of 30, pap smear shows CIN2, still HPV to be given?
First, we have to treat CIN, because that is the urgent need, and we have to follow. And our second thing, among healthcare workers, actually among us, we have to say that when we give vaccine to the children, that is quite different. We give measles, we give rotavirus, whatever. But the HPV vaccine and the relation with CA cervix, it is organized. It is something that you have to. We have to be with any form of screening for women. It may be organized one, it may be individual women. So HPV vaccination does not make you careless, neither on the part of people who is taking vaccine, neither part of us. So the regular screening for CIN, for the VIA, LIA, whatever it is, cytology, whatever is available and feasible, we cannot go away with the screening, and that should be very, very clear, because the people want to say abhi vaccine le liya, and then they can do for all unsafe sexual practices and not going. So this is a very, very important difference between other vaccine and the HPV vaccine. Because CIN2, you are now making this thing very confusing. CIN2, we want to treat it fully, then we want to follow her. And at this moment, where HPV vaccine really stands as a professional, I think we are at a loss that it will have any benefit or not, because already HPV DNA has started working and it has been changed. So our priority should be.
Priorities have changed. Yes, right, ma'am, right.
So I think we've answered all the questions. And anything more you want to add, Smila ma'am, Anita ma'am?
No, I think most of the things have already been covered, and most important, as I said, is that we must make an effort to make it a part of the national program. So otherwise, we will reach here and there. And Dr. Neeta has been pointing out also, cost, and also has been pointed out by Dr. Sadhna also that, cost is a consideration, but we must, till it gets integrated, and we must keep on writing. That is important part to the different officials. Have repeated roundtables, and this will carry a meaning. And the people who are organizing this can definitely have a communication for the various journals, so that our journals, health magazine and all, because people's demand will make it a part of universal program as well. We already are aware of the burden of the disease. We don't have to talk much about that. And India, I'm sure, is going to be much more higher, because, quite a number of times we do not, even approach to the women, because they consider the symptoms as normal. And by the time it is detected, it is too late. And quite a number of times. So we have to look at that, how we can make an effort to make it a part of universal immunization program. That is very, very important.
That is very true, because today's, Dr. Sunila, what we change in our country's environment. Government is like focusing on the women problem, women's self-sufficiency, women's vote. The government is forced to have the women in the mainstream, and with social media, somehow it may have some issue, but it has a positive impact also. So we can really make this environment, this positive environment, when women are speaking up for their issues, for their sexual thing, and for their so many things. So this is the time when, as a professional, we can do a lot, because we can have a voice over large number of people, be in social media and be the women empowerment group. And this is right time that we can handhold each other.
Very, very right, Dr. Sadhan. After this meeting, I'm going to immediately do a tweet, and I will say that every one of us should tweet about HPV vaccine, so that, at least some dissemination will do, because Twitter is something which I see that it spreads so very fast. At least 4 of us can tweet right now. And along with Deepika, you can promote that, very fast. So that it will be retweet, and we can reach the, many people that way. That should be the pledge which we all 4 take from this platform, or 5 of us. And every participant who is listening, in fact, our request should be that you should do tweeting about the vaccine as well.
For me, it was sort of test and discussion, like how my kids do TND, where I read about it. And oh, ma'am, there is message from Dr. Nandish that we will retweet once you tweet. So
yes,
it's a good awakening and wake up call for everyone. And I think our purpose is solved. So we could read and learn. And I will request Nirmala ji on behalf of Lioness to thank all our esteemed experts who are here. Ma'am, words cannot express our gratitude to Sheila ma'am, Sadhna ma'am, and Dr. Anita Kant for being with us. And thank you, Deepika ji, out of box, you've given us time to be on this platform. So do we conclude here with all our thanks to everybody? And these recordings will be available on Facebook Live and your YouTube channel, which is now multiplied so vastly. So thank you, Team Jagsonpal, and thank you, everybody. And Dr. Sonu Balar has also joined. Dr. Sonu, you want to say anything about HPV vaccine?
I was like, we were discussing in the afternoon, I was not very keen on giving it due to the side effects, but you have explained it very nicely. And in the afternoon also, like we were discussing. So maybe it is better that we give. I couldn't hear due to the network issues in between, but I think the recording which we may hear, Deepika has been very good in putting all the recordings of all the webinars. Yeah. So
Jagsonpal.
No.
Jagsonpal.
Yeah.
Make us so.
Exactly. So no, it was a very good session. So thank you for explaining everything beautifully.
Thank you, Dr. Sonu, for joining us. And with this, we can conclude the session. I think all our questions are answered.
We present to you, Jagsonpal has LycoRed, the cell protector, the ultimate cell protector, which has lycopene as Lycomato. Lycomato is the real extract of tomatoes, which contains all the phytonutrients along with zinc and selenium, so that it has a more potent free radical scavenging effect. There are about 35 clinical trials with LycoRed and about 56 publications now on the net. Otherwise, we also have another product, that is Yuliprist acetate, which is now back after the DCGI approval. Please do start prescribing again. Thank you all very much, and we hope to see you again.